I'm Dr. Greg Erickson. This is my wife, Dr. Stephanie Erickson, and we're both physicians here at the Mayo Clinic Health Systems in Red Wing. I'm orthopedic surgeon, and Steph is a family practice physician.
We actually met in the Air Force. It's kind of a funny story. We were both active duty Air Force physicians and were sent to help support the Boy Scout annual jamboree. And we met in the emergency room. He was the orthopedic surgeon doing consults, and I was the ER doc covering kind of minor traumas and things like that. And I guess, as they say, it was love ever after when we met in the ER. So I guess that was about 7-8 years ago?
Yeah, so medicine brought us together. We eventually ended up working together in the same hospital in the military for a while, and then we're in private practice groups separately, and then now excited to be back working in the same facility here in Red Wing.
I think the nicest thing about being married to medicine or married to someone else in medicine is that they get, the joys, and they also get the sadness and the frustrations, be it from the electronic medical record to all the new red tape that seems to come up every year in medicine. But they also get the highs, when they get it, Greg gets it when you really enjoy a patient encounter, and we love to tell each other those stories. And then it's also convenient now living both working in the same department, or as far as the same hospital, that he gets to see the same patients I do, and we can share our own expertise with each other, and it's been a lot of fun.
Sure, we both have our area of specialties and rely on each other sometimes if we have questions that are kind of outside our area of expertise. Steph has a broad background in general medicine, and I'm more focused in orthopedics. So when she sees orthopedic-related injuries, oftentimes she'll give me a call and say, "Hey, what should I do with this?" and vice versa. If I have a orthopedic patient with a medicine issue, I may ask for her advice as how does that need to be managed. So it's nice having someone kind of on call 24/7.
He thinks I'm on call 24/7. Well, I've been already asked by several patients, so Omaha to Minnesota or Minnesota Red Wing, and I smile and I say, well, I married a Minnesotan, so I kind of got dragged here. No, just kidding. We decided collaboratively to move here. We have 4 kids and a big 80-pound lab, and they keep us very busy. But Greg can talk a little bit about family and why we're here.
Yeah, so family is the main reason that brings us back. I grew up in the Twin Cities and went away from college, and then with my Air Force duties was bounced around the country for a little bit, but always loved visiting Minnesota. And after I introduced Minnesota to Steph, she felt the same way and really enjoyed spending time here, spending time more with our families, and came to the realization we'd just rather live here rather than just visit several times a year. And so we're excited to be back. We love the outdoors. Steph's an avid runner. I'm a big cyclist. We both enjoy skiing and hiking. We've got family cabins in northern Minnesota that we like to visit, like getting out on the lakes, doing fishing and water skiing and those sorts of activities. So we're very excited to be back.
I think that what I have been impressed with is the collegiality of the staff. When I have a cardiology question, orthopedic question, well, he better answer his page, no. But when I have any other consults that I need, people that work here, the people that make up the Mayo team have made me feel so welcome, and no question is dumb, and bring your patient by, bring the chart by, let me figure it out with you, not for you, and there's no judgment. So I think the team approach and all of us being under one roof it's been fantastic.